So my name's Sarah Eales. I'm 38. I am a home dialysis patient. I've been on dialysis nearly 3 years, been at home nearly 2, and I've been in kidney failure for 7 years. I think it'll improve it massively. Now, I'd never had to get hospital transport from the unit. My husband picked me up when I was here, or I'd walk. But there is patients who need transport. They're brought to the hospital and they're taken home. And sometimes they're here an hour before treatment. So that means they have to sit in that waiting room to wait for their treatment to start. And then they're having to sit there afterwards as well. Now, if you can imagine 4 hours on dialysis in the unit, tired, you just want to go home, you don't feel very well. A lot of them don't feel very well after you come off. And then they have to sit there and wait for the transport. Some of them live quite a way away. Going home tired, coming in tired. You want somewhere that's inviting, you want somewhere that you're all right to sit and wait and you don't mind having to wait for your transport. Not even just transport, it's coming in for appointment. And if you've ever sat in that waiting room, it is freezing. It's just not a nice place to be. So I think the money raised will just change patients dramatically. Well, I can tell you if it wasn't for the staff in that unit, I wouldn't be doing home dialysis right now. I've had kidney reflux disease my whole life. I had my kidney taken out when I was 6, but I was always just brought up like normal, just going to the hospital every 6 months or so for a checkup. So when it came to me starting dialysis, I'd had 3 children on this one kidney, and I knew it was a possibility, but you just don't think it's going to ever happen. And when it did, and I had to come over to the unit, I was absolutely petrified. I don't think they'd ever seen a patient as scared as me. Like, I was visibly shaking, crying the lot. And quite quickly, they had me setting up my own machine, doing my own packs. I was doing my own blood pressure, doing everything like that myself, like the shared care. You can do whatever bit of it you want. And they used to say to me, you're going to end up needling. And I used to say, I can promise you now, I am not going to needle myself. It's not going to happen. And as time went on, we decided to use buttonholing on me, so blunt needles. And one day, one of the nurses just said to me, do you want to have a go? And I don't even know why I said it. I said yes. And it was just them slowly encouraging all that time. And I did it myself. And from there, I decided to go home and do home dialysis. And if it wasn't for them nurses and that staff in that unit, I wouldn't have done it. They're there for me, they're there for my family, they're at the end of the phone whenever I need them. They just come over at the drop of a hat if I need them, bring me stock, whatever I need, they're there. They're there to encourage if I've got any problem with machines. They work so hard. I just think this money raised for that unit will make such a difference, not just to patients, but to the staff as well. Not only am I wearing a t-shirt, you can see, but yes, I am doing a skydive on the 4th of July, hopefully. I have actually surpassed my target, so I am still raising money. Target was 350, I think I'm on 375. So I am still raising, so I've got a personal target in mind. Please call this number to donate whatever you can. It really will change lives. We are trying to raise £500,000 to change that unit. It will change patients' lives. Trust me, I know.